without any further ado, I'm going to introduce our first speaker. Dr. Anderson Stanciole is a health economics advisor at the UNFPA Asia-Pacific Regional Office. He's responsible for providing technical assistance on health financing to promote equitable and efficient sexual and reproductive health and rights service delivery. Before that, he was at the Gates Foundation, where he led the creation of a portfolio management system to provide visibility into the global health product development pipeline. He also played a key role in managing the relationship with the Institute for Health Metrics and Evaluation at the University of Washington. So please join me in welcoming our first plenary speaker.
Thanks so much, Jennifer, and good afternoon, everyone. It's a pleasure to be here. It's my first time attending this conference, and it's been very interesting and instructive for me. And today, I wanted to talk to you about a recent work that we did on sexual and reproductive health and universal health coverage in the Asia-Pacific region. And I'll try to be brief. There are three main points that I want to cover. First, setting the context of how do we think about UHC and sexual and reproductive health. Then I'll talk to you a little bit about the results of a recent study that we have done in 6 countries in the region, and come to the conclusions and recommendations. I know many of the people here are very familiar with UNFPA, but I think it is useful to take a moment to talk about the 3 transformative goals that we have as part of the current strategic plan. And they focus on 0 maternal deaths, 0 unmet need for family planning, and 0 harmful practices, including gender-based violence and FGM and other harmful practices. So I wanted also to touch on the issue of how do we look at the global context of the SDGs and how they may reflect on the issues of SRH services and UHC. We heard about in some of the other sessions about that. I think there are 3 key targets that I think we need to highlight, as you can see in the slide. The SDG 3.1 is about maternal mortality, and there's a target to reduce that to an average of 70 per 100,000 live births across the world. And we know that in this region, many countries are not there yet. And I think what our analysis is showing is that with the current rate of improvement, they're probably not going to be able to reach that level. So when you think about maternal mortality, it's still very much a very important issue for the countries in this region. While we have countries that are middle income, they're relatively well off, but it's very important to make the point that we're not there yet. There's still a long way to go for most countries, so there's a really big importance in keeping that in how, especially national governments, set their priorities. SDG 3.7 is about universal access to sexual and reproductive health care services, and that includes a whole range of services, and I'm going to come back to that in a little bit. And then SDG 3.8, it's about universal health coverage. So it talks about financial risk protection, essential health care services, and affordability of essential care and medicines for all. I think for most countries, they are really interested in how they can reach UHC, and there has been a lot of discussion about that and a lot of support, and there's a big momentum at the moment. Now, when we think about this, the question that we're trying to answer is, fine, so we have UHC as a big priority for many countries that has a lot of ownership and a lot of support. How is it being able to really address SRH needs? And I have to say we're really looking at SRH services at this point. So the issue of rights, it's a little bit broader, but I think it's still important to consider the issue of services. How are they being covered or not covered under UHC? And what are some of the issues that countries need to take into account as they push toward this very worthy goal? A lot of people are very familiar with this diagram to the left, which shows the 3 dimensions of universal health coverage, and that has been really useful to galvanize countries to action. So it's looking about coverage of services in the right-hand side, the coverage of population, ensuring that especially the most vulnerable people are covered. And on the vertical axis is looking at the financial risk protection, so how much people have to pay for accessing services. So there are different ways we can consider this issue, and if we start from the functions of the health system's financing, that gets us to intermediary objectives and the goals. And as I said, the goal is really to provide access to a wide range of services to a wide range of people at an affordable cost, so that they are not facing financial hardship to access those services. So fine. So what does that mean then when we look at sexual and reproductive health care? And that's where some of the challenges start to appear. I think this is showing that to some extent, many of the things that are part of SRH, they may not fit completely within the current schemes of UHC. And what we are saying is that while some of the broader issues may need to be reflected in broader policies, there's also need to look more carefully at some of the health services that should be part of UHC, but as I'll show in some of the analysis that we have done, it may not be quite there yet. And just to remind, the issues related to SRH are very complex. They may cut across different sectors, which are not only covered within UHC generally. I think this is one way to start to understand how that plays out in the region. We developed this index that looks at access to services by looking at adolescent pregnancies, skilled birth attendance, and unmet need for family planning in the vertical, and comparing that to the financial risk protection that we see across countries by looking at out-of-pocket payment. So what this is showing is that while we have some countries like Thailand, which is really a star performer, you have very low exposure to financial risk and very high access to services in general for SRH. There are many countries where, as you can see, there's still a long way to go. And I think what we're trying to highlight to our counterparts is this is an area that needs more attention. Here, something that is very familiar to all of you, as you can see, there has been great progress in expanding access to these services. We have here contraceptive prevalence rate, antenatal care, and skilled birth attendance. So overall in the region, we have seen a lot of progress from 2005 up to 2013. But I think also what this is not showing are the big inequities and differences that we also observe within countries, which I'll come back to later. And let's get right to there. I think our study, we looked at 6 countries. We looked at Bangladesh, Cambodia, Indonesia, Mongolia, Thailand, and Vietnam. And the reason we chose those countries is that they are at different stages in terms of developing and implementing universal health coverage, and they would provide a nice snapshot of what are the concerns along those different stages. In terms of the scope, we're looking at a selected number of services. We're not able to do the full scope right now, so it's mostly about family planning, including emergency contraception and abortion care, antenatal care, maternal health services, STI diagnosis and treatment, HPV vaccination, cervical cancer screening and treatment, and GBV services from the health sector. And what we see in this first slide that I'm showing you is, if you look at family planning, overall there is very good utilization across the region. So in most countries actually, with the exception of Indonesia, the contraceptive prevalence rate among the poorest quintiles of the population is higher than average. So that's very positive. However, when you start to unpack that a bit more and you look, for example, at adolescent fertility, you'll see there is a very substantial and sizable gap between the richest and the poorest. And we think that this is related to lack of access to services, which will, at the core of what we're talking about with UHC. When we look at antenatal care, there has been substantial improvement over time, but there's still some gaps, especially in the low-income countries. Skilled birth attendance, kind of similar, but I think at a lower coverage and even bigger equity gaps. So these are things that need to be clearly highlighted because when you talk about the average rates, it might look very good, but when you start to unpack things, that's where the big issues start to arise. This is, I think, an interesting look at what are the types of services that are included under UHC. And I just want to point some of the things that you see. So, unfortunately, it's not very clear in the slides. But what we can see is that in most countries, there are significant gaps in terms of what types of services are covered by UHC schemes. So when you look, for example, at family planning, emergency contraception, most countries are not yet covering those as part of their main UHC schemes, and that's a reason for concern. And the other thing that I also want to highlight is that the coverage of those schemes is also not 100% in most cases. So, which means that even though we're looking at the regulations as such, the actual implementation are not quite there yet. I have to go a little bit quicker. On this one, I just wanted to say there is not a lot of information about financial risk protection for SRH, but what we can see clearly is that countries with more, actually with less public investment in health, they have more out-of-pocket payment and lower coverage, which is, again, a concern. So quickly, I just wanted to briefly mention the main conclusions and recommendations we have. I think the first thing that I already noticed is that SRH goes beyond the health sector. And there's a big danger in, when you look at the UHC only, that some of the services may not be covered and captured adequately. And I think some of the things that I would call out here is the issue of adolescent fertility, which is not only about services, it also involves issues of social norms, rights, access to information. Similarly to gender-based violence, a big part of the response takes place outside the health sector. So how do we call attention to that fact so that it doesn't get lost into policymakers' minds? The second thing, which I think is very important, is that in general, UHC is not giving appropriate attention to prevention. So a country like Thailand, which is very advanced and has reached the UHC for a long time, is just now starting to realize the importance of investing in prevention. So things like HPV vaccination, we still have very low rates of utilization. Contraceptives, special adolescents, as I mentioned. And I think also this is an important opportunity to highlight that the SRH can actually contribute to improving the sustainability and financial effectiveness of UHC. So if you can promote those preventive services, that can lead to better outcomes and less costs. I think the third thing is that we see part of the UHC discourse is to improve the efficiency of the system, reduce fragmentation, have better outcomes, better value for money, which is really good. But also important to ensure that vulnerable groups are not left out of the equation. So having appropriate mechanisms to include people that may not be able to afford healthcare premiums, avoiding health user fees at the point of care, are important design issues that need to be considered. And then finally, the issue of coverage of adolescents. I know it's been part throughout of the conference, and you know much better than I do about that. And then finally, the issue that universal health coverage is often not universal. So how do we ensure that really there's no one left behind? Looking at ethnic minorities, the coverage for migrants, refugees. There are many cases, good examples in some countries. And I think also recognizing that the SDG goals, in order for them to be reached, everybody in the countries will need to see overall improvement. So to conclude, I think what we're trying to show is that universal health coverage and SRH are two very important agendas for our governments, but they need to be working together. We need to ensure the complementarities and also promote actions that where this efficiency and equity can come together to improve the overall performance. Thank you so much.
Thank you so much, Dr. Stanciole, both for your presentation and for sticking so obediently to the time allotted.